The skill that I'm going to do is administration of an IM. The first thing that I'm going to do is I'm going to check the MAR. I'm going to verify the order that I'm supposed to be giving John Doe 1 ml of an injection, antibiotic. So I'm going to make sure I verify that, make sure I got the right patient, medication, administration, route, time, documentation. I think that was the 6. I'm going to compare what the order says in the chart and the doctor's order. So after I've done that, if I don't know exactly what I need to do, I'm going to check the medication book. I'm going to make sure I know like the signs and symptoms to look out for, any contraindications, anything like that. So then I'm going to calculate the medication. I am going to get my supplies. So this is an insulin syringe, but we're just going to act like it is a syringe for an IM. And I'm going to get my, I don't know, my Cipro or something like that. My alcohol wipe. I'm actually going to need a couple. And then this is another alcohol wipe, but we're going to act like it's a gauze. And so I'm going to check the medication, make sure it's not expired, make sure there's nothing crazy looking in there, no floating particles that's not supposed to be in there. So I'm going to get that. I'm going to clean off the top of the valve, 30 seconds. Okay. Then I am going to open my syringe and I am going to take the cap off or pull it back, and then I'm going to stick the needle inside of the medication. I'm going to invert it, and let's just say this person's going to get 3 mLs, but this is only, what, 1, I think? Yeah, I'm just going to pull it up. Then I'm going to make sure I have my cap placed on a hard surface so I can recap it. You're never supposed to use your hands to recap. And you're not really recapping, you're just covering it, because you should never recap either. Let's see. And then I'm going to put the name and the patient's name and the medication on the syringe. But usually I would do this at the bedside and not in the medication room. So then I'm going to go into my patient's room. Can I come in? Can I come in? Okay. So I'm Siobhan. I will be your nurse today. I came to give you your IM injection of your antibiotic. Is that okay? All right. Can you tell me your name and your birthday? So the person is going to be John Doe, room 222, birthday 39, 85, 4, 3. Okay. And then after I verify that, I am going to tell the patient, well, ask the patient where would they want to get their IM injection. So this patient is going to tell me they want a deltoid. So with the deltoid, I'm going to roll up the sleeve. I'll move this over just a little. Okay. Okay, so I'm going to wash my hands. I'm going to pull the curtain, and I am going to, then I'm going to, raise the bed or whatever it is that I have to do. I'm going to roll the person's sleeve up all the way to their shoulder as far as I can. Okay. And then, can you just, yeah. So the way that I'm going to find my landmarks is I'm going to put my hand on the top of the shoulder blade or the acromial process, and I'm going to put 3 fingers like where the bone is. Okay. And then I'm going to get my dominant hand and I'm going to make a V. And then that is where my landmark is. So I will get an alcohol wipe, and then I'm gonna clean that area from inside to outer for 30 seconds. And then I usually leave the alcohol wipe where I know I'm gonna give the injection. Okay, so then I am going to let the patient know, okay, so I'm going to be giving you your injection. So I'm going to pull the skin down. I'm going to taunt it. Okay. I'm going to let that alcohol wipe dry a little more. I'm going to take my top off. Okay. And I'm not going to really stick you. And then I'm going to go at, this is a average size man, so I'm going to go at a 90-degree angle, and I will go in. I will push the plunger, and then I would pull it back, and then I would let go of the skin. I would put my safety mechanism on for that, and then I would, let's just act like this is a gauze, and I would just place the gauze on there firmly, and make sure that the patient's not bleeding. Sometimes they do bleed, so I will get a Band-Aid and give them the Band-Aid if they need. If not, I would just take that off, make sure there's nothing there, and then I'm gonna roll his sleeve back down, and I am going to take my gloves off, wash my hands, put the patient back down in the lowest position, hand him his call bell, gather my supplies. I would gather my supplies before I got rid of my gloves. So I would gather all my supplies, then I would get rid of all my supplies, then take my gloves off, wash my hands, make sure my patient's in the lowest position, and I will document the time and what I just gave, and I would ask the patient if they needed anything else from me before I would leave, and then that would be what I would do. All right.